Epilepsy is a challenging subject for many people. Now, it's estimated that 3.4 million people around the world actually suffer from epilepsy. About 3 million adults and 47,000 children nationally in the United States suffer every single day from epilepsy. Now, about 0.6% of children aged 0 to 17 have active epilepsy every single day. Now, think of a school with 1,000 students. This means that about 6 of them could have a seizure at any moment. Actually, one of my buddies a few months ago, he has seizures frequently. We had to call an ambulance recently because he was fully unresponsive one of the nights we were hanging out. Now, with help arriving immediately on site, I watched my buddy get pulled out on a stretcher because of his lingering disease. Now, after some research, we found that there's newly found medicine called medical cannabinoids that can help patients. Now, there's a lot of debate in the political world that medicinal marijuana is a complicated and controversial issue. There's no doubt that medical use of cannabinoids should be influenced federally because of their heartwarming and helpful effects on patients, rather than the existing addictive medications some patients are often put onto. Now, there's very little evidence that shows a negative effect on a person's health, including certain respiratory diseases and one of the leading causes of death in the United States, heart disease. There's no doubt that these medications can have a positive impact on the lives, and we've seen this repeatedly. Therefore, we need to pass federal laws and enforce the use of healthy medications across the nation instead of our existing drugs we use. Also, medicinal use of cannabinoids have not been proven to cause any sort of underlying health issues or the use of heart disease in the United States. Now again, in the United States, there are about 8 states total that condone recreational use and allow for medical use, and 28 states that allow for strictly medical use. In these 28 states, there have been numerous tests performed on patients across the board that indicate that medical marijuana can have a positive impact on the patient's lives. Now, these medicines have a positive impact because we've seen repeatedly on diseases such as patients with cancer, patients with post-traumatic stress disorder, and epilepsy. CBD can have a positive impact on their lives and help with many symptoms, lack of appetite, and even anxiety. Now, from a statistic from Citran.org, more veterans actually commit suicide than the number of veterans who died in combat in Vietnam. Now, an estimated that 70% of adults in the United States have experienced this traumatic disorder event at least one time in their lives, and up to 20% of these people go on to develop post-traumatic stress disorder, or PTSD. Now, Professor Adams from Capella University, he says that a prescription of medicinal marijuana or cannabis-derived products can ease many of the symptoms from PTSD, cancer, and seizures. Now, the NASEM says, regarding the link between marijuana and cancer, the committee found evidence that suggests smoking cannabis or ingesting it does not increase the risk for cancers often associated with tobacco use, such as lung, head, and neck cancers, including heart disease. Now, there's limited evidence whether cannabis use is associated with certain respiratory diseases, including chronic obstructive pulmonary disease, asthma, worsened lung functions. Now, as a final conclusion, there's been very limited evidence that the use of marijuana cannabis products can lower a person's immune system also, and can have harm on a person's health after consuming that product. Now, Professor Adams stated, a prescription of medical marijuana or cannabis-derived products can ease many of the symptoms from cancer, including nausea, cancer, seizures, and PTSD disorders. Therefore, we need to pass federal laws to enforce the use of healthy medicines across the nation instead of our existing drugs and other forms of medicine that can actually create an addicting cause, create a very addicting substance after taking these different medicines. Now, medical marijuana and other cannabis-derived substances can have a positive impact in a wider variety of illnesses. Patients with cancer, post-traumatic stress disorder, and epilepsy, and more can see the benefit from using medicinal-derived products such as CBD oil. Medical marijuana can have a beneficial and viable option for patients and should be used for doctors around the nation as a substitute for the already existing drugs we use. And I believe that it can cause a more fulfilled life for the patients.